nurses there, this is RN Shweta and welcome to my channel Nursing with RN Shweta. So today once again I've come up with a very important topic from Fundamental of Nursing, that is standard precautions. So guys, what is standard precautions? Standard precaution is the group of techniques that we use in order to prevent the transmission of diseases through any ways, through airborne, through contact or any kind, from one person to another, like either from one patient to another in the hospital setting or even from the patient to yourself as a healthcare member. So today we are going to learn about all the protective measures that we use, like goggles, mask, face shield, gown, gloves and footwears, everything that we use as a standard precaution to prevent the transmission of diseases between two individuals. So guys, the most important step of standard precaution is hand washing. Yes guys, it is very basic, hand washing or hand hygiene. We have been listening to this multiple times, but this is the most effective and the most important step that will prevent the transmission of diseases. It comes under standard precautions. Okay, now we have some of the equipments that we use in order to protect ourselves from the transmission of diseases under the standard precautions. So starting right from here, we have eye goggles, or we even have the face shield, right? You might have been very much familiar about the face shield after COVID. So eye goggles or the face shield, it helps you to prevent from any of the splashes of body fluids or blood while doing any kind of procedure. Next we have mask. We all know mask helps us to prevent ourselves from any kind of airborne or droplet mode of transmitted diseases, right? The third thing we have is gown. The gown is used where the procedures has the chances of your clothes getting soiled by body fluids or blood. It protects you from that. Okay. The next we have is gloves. The gloves, it will help you to prevent the contact between the patient's body fluids and your skin. We also have routine alcohol decontamination that we have to do with alcohol-based solution. Okay, routine decontamination can be done. It also comes under standard precautions. So now, all the equipments are not like you can wear anything anytime, and while removing as well, it's not that you can remove anything anytime. We have a strictly advised and proven steps like which equipment should be worn when. So let us move into donning and doffing of the standard precaution equipments. Guys, all these standard precaution equipments that we have, goggles, face shield, mask, gown, gloves, these comes under an umbrella term known as PPE, personal protective equipment. I'm sure you all are very much familiar about this term PPE, personal protective equipment after COVID, right? So PPE also has a specific guideline so as to how to step by step don in the PPE and how to step by step remove the PPE in order to prevent the transmission of diseases from the patient to yourself or from yourself to the patient as well. So guys, let us first learn how to don in the PPE kit. The first thing during the donning is the gown. The gown will cover almost your full body part, right from your neck till below your knees, all your arms till your wrists, okay? And it will be tightened at the back with the lace attached to it. It will help you to prevent the splashes of blood and body fluids during procedure in your clothes, so that your clothes does not get soiled with the body fluids. Okay, the second thing that we don in is the mask or respirator, we call it as. So the mask, guys, always has to be fitted here in the nose bridge here, and down it should be below the chin so that it covers your entire part, this part. Okay. The third thing that we have is the goggles, eye goggles or the face shield. So this also, guys, will help you to prevent the splashes of blood or the body fluids into your eyes or into your face, the goggles and the face shield. Okay, and the last or the fourth thing that we don in is the gloves. The gloves, guys, will have its appropriate size. So you have your own size of gloves. You should have your own size of gloves. Okay, that has to be fitted in, and also it should cover the wrist part of the gown. The wrist part of the gown usually is elastic, so the gloves has to cover up the wrist part of the gown. This is how you don in the PPE kit appropriately. Similar to the steps that we had while donning in the PPE, we also have steps to follow for appropriate removal of the PPE after you are done with the procedure. So let us learn how to step by step remove the PPE after the procedure. So the first thing you need to remove are the pair of gloves that you have used. You remove the gloves with the opposite hands and discard it in the appropriate colored bin. Okay. The second thing you need to remove is the gown. The gown has to be unfastened at the back and allow it to fall off from the front part. Okay. The third thing that you need to remove is your goggles or the face shield, right? And then at last, fourth, we need to remove the mask that we have used. Either you can unfasten the lace at the back, or if it is the elastic one, you need to remove it from here and discard it in the appropriate bin. After removing the PPE kit step by step, make sure that all the one-time use equipments have been discarded appropriately according to the color codes of the hospital that you're working in, according to the biomedical waste management that your hospital follows. Okay, and then whichever are the equipments that has to be cleaned and reprocessed, please follow the hospital guidelines that you're working in and make sure you discard it in the proper way.